I want to share some exciting new developments in prevention of skin cancer. As you know, skin cancer is a huge problem for people, particularly people who are fair skinned. When we look at skin color, some people are very fair, very light. People, particularly of Irish or Scottish background, tend to be very fair skinned. These are the people who are at most risk for what we call non melanoma cancers. Squamous cell cancer, basal cell cancer, and actinic keratoses are common problems. And these are directly related to sun exposure. There's a vitamin B, a vitamin B3. It's also called oral nicotinamide. And that has some promise in protecting people against skin cancer. Now, the studies that were done primarily in immunocompromised patients, but there's some evidence that this carries over to people who don't have immunocompromise. If you're fair skinned and you take an agent to protect your transplanted organ, for instance, if you had a kidney transplant and you're taking azathioprine to protect your organs so that you don't lose that organ, you don't develop organ rejection, you are at particularly high risk for basal cell cancers, squamous cell cancers, and actinic keratoses. But this is true for anybody who's fair skinned and spends a lot of time in the sun, especially if you work outside. So, taking vitamin B3, which is also called oral nicotinamide, 500 milligrams twice a day can decrease your risk for skin cancers. It doesn't help protect against melanoma, unfortunately, but it can help protect against these other skin cancer types. Now, don't forget the other things that we need to do to protect our skin. It's important to try to avoid sunburn if you're able to do that. If you are going to be outside for a long period of time, it's a good idea to wear sunscreen. There's some types of sunscreen that are better than others. The types of sunscreen that are best and safest are titanium dioxide and zinc oxide sunscreens. What's the difference? Well, some of the types of sunscreens that are out there are made with chemicals, and those chemicals can be absorbed into our skin. Some of those chemicals have been associated with other types of cancer, so it's important to avoid those if you possibly can. The other thing that you can do, some people don't like to wear sunscreen. So if you don't like to wear sunscreen, there's other things you can do. You can wear a hat, you can cover your skin, and there's some types of clothing that are especially designed to help protect your skin from the effects of the sun. So enjoy the sun. It's New England. We don't get enough of it, but do it safely.